Hello, everyone. Welcome to another exciting edition of Synlab podcast. My name is Juliet Nebe, and I'll be your host. Today, we will be talking on the topic, the heart of the matter. Is your heart in top shape? And I have with me here two amazing doctors to do justice to this topic. Do not forget to like, subscribe, share, and follow Synlab Nigeria on YouTube and on Spotify. Before we dive into the questions, I would like to formally introduce our esteemed guests by reading their respective bios. Please meet Dr. Oladeji OLAJIDE and Dr. Juliet Nebe. A pleasure to have you here today.
Thank you.
So, formally introducing them, I would like to start with Dr. Nebe because he's ladies first, sir. Okay, so it says here that Dr. Juliet Nebe graduated from the College of Medicine, Nnamdi Azikiwe University, Awka, Anambra State, Nigeria, in the year 2000. Wow. She completed her NYSC at the Amuwodofin Local Government Medical Center. Following her service year, she joined a reputable private hospital as a medical officer, where she gained extensive experience in patient care and healthcare management. Her dedication and competence earned her promotion to Deputy Medical Director before she commenced her residency training at the Lagos University Teaching Hospital, Lagos. Wow, that's impressive. Before you even commenced your residency, that's quite impressive, ma'am. In 2015, she became a fellow of the West African College of Physicians and was appointed a consultant in the Department of Family Medicine at Louth. In this role, she trains family medicine residents and conducts research in various areas of medical practice. She is also a fellow of the National Postgraduate Medical College of Nigeria. Dr. Nebe is a certified trainer in advanced life support in obstetrics. She holds a certificate in leadership and management in health from the University of Washington and a CDE diploma in geriatrics from the South African Society of Geriatrics. Quite impressive, ma.
Thank you.
And it keeps going on. Her professional affiliations include membership in the North American Primary Care Research Group, NAPCRG, the International Society of Travel Medicine, and the Pan-African Travel Medicine Federation. She is also the immediate past financial secretary of the Nigerian Society of Travel Medicine. Wow. Dr. Nebe is deeply passionate about lifelong learning and sharing knowledge with a strong commitment to continuous holistic patient care, the cornerstone of family medicine. She is married and blessed with children. A pleasure to have you here, ma'am.
Thank you very much.
And allow me to say, quite impressive.
Thank you. Thank you very much.
But I'm curious, though, why family medicine?
Okay, as I said in my bio, I started out as a medical officer. So when you practice medical care in the community, you get to see a lot of people, irrespective of the age, of the disease condition. So they come to you first. It's you that determines whether this you could manage or this you could refer. So it's informed me in my particular care because I garnered a lot of experience. I found out that as a doctor, you can give a lot to the community.
Of course.
And that's what family medicine offers.
Oh, wow.
Family medicine trains you better to coordinate this care, better to manage these patients, and is a continuum from cradle to grave. That's what we say. So all through the life of a patient, you know them. You get to become a member of the family, that's what happens in family practice.
Now that you've put it this way, I think I see what you're trying to say. Wow, that's quite impressive.
Thank you.
Nice to have you here today once again.
You're welcome.
So finally coming to Dr. Oladeji OLAJIDE. So Dr. Oladeji earned his MBBS from the University of Lagos in 2007 and initially trained in anesthesia for 3 years. In 2021, he obtained a fellowship in cardiology from the West African College of Physicians, marking a decisive shift in his career path. His passion for cardiology stems from a deep concern for the growing burden of cardiovascular disease and a desire to improve how these conditions are diagnosed and managed. With a keen interest in preventive cardiology, he focuses on hypertension, heart failure, and arrhythmia management. Dr. Oladeji is renowned for his meticulous approach to care, consistently identifying subtle clinical cues and delivering individualized, effective interventions. He leads the cardiology unit at Federal Medical Center Ebute Metta with a blend of clinical precision and empathetic leadership. Wow. Academically and clinically, he has made significant contributions. He is the lead author of several studies on heart failure and atrial fibrillation and has co-authored multiple influential publications. His research continues to enrich the field and raise the standard of cardiovascular care. Looking ahead, Dr. Oladeji is particularly enthusiastic about the integration of artificial intelligence and telemedicine into cardiology. He views these tools as essential for expanding access and improving efficiency in cardiovascular care, ensuring his practice remains at the cutting edge of medical innovation. Massive wow.
Thank you.
When I saw artificial intelligence, I'm like, okay, somebody is moving with the time. That's actually impressive.
Yeah, that's the way to go.
Yeah. And I'm particularly impressed about your keen interest in preventive cardiology. The fact that it is preventive struck me. Why did you venture into that?
Okay. So, talking about preventive medicine, there's a place of early detection.
Of course.
Because we live in the part of the world where people don't really want to use medication. And also in Africa, we present late in conditions whereby the little you can do, then the cost of all these interventions are quite expensive. So if we can go the way of preventive, then we can reduce the burden of cardiovascular disease in general and also reduce costs of medical treatments.
Thank you very much. When you said we present late, it struck me a lot. A lot of people really do not like medication, like you said. Once again, it's lovely to have you here. I'm looking forward to an exciting discussion with both of you.
Thank you.
So, like I said, do not forget to like, subscribe, share, and follow Synlab Nigeria on YouTube and on Spotify. In this first episode, we shall be talking about knowing your heart. So for the Gen Zs out there, it's not the heart you're talking about, though. This one is cardiovascular, the cardiovascular organ, the one that is pumping blood. It's not relationship program that we are seeing. Just kidding. So, I'd like to start with Dr. Nebe. Okay. What does the heart do beyond what we learned in school as per biology?
Okay. Generally, we know that as per biology, we are told that the heart pumps the blood. Okay, the heart does more than that. He's a cardiologist.
Yes.
And we know that apart from pumping the blood all over the body, there's a specific thing that the blood carries. So without the heart pumping that blood and the blood flowing, it will not carry oxygen,
of course,
which is the bane of life. So the heart is the bane of life. Because as it pumps, it has to carry oxygen. Not only that, it also carries the food particles. Because even if you eat all the best things in this world and the heart does not pump the blood, it will not get to the intestine. It will not carry the things you have eaten. It will not direct it to all over the body. You know. So apart from that, also the heart also has things, what we call receptors, that picks when things go wrong. That is why the first thing we do when somebody slumps here is to attack the heart. I'm using a simple language that we attack because we feel I'm beating somebody that has slumped. But instead of pouring water, we attack the heart. Because without kickstarting that heart, everything goes. So the heart is the bane of life. So it does more than pump blood. It carries the food, it carries the oxygen, it predicts when things go wrong, and it showcases it to the world to see.
When you put it that way, it sounds very interesting. Showcases it for the world to see. Dr. Oladeji, did you want to add something to that?
All right.
Seeing that you're the heart person.
All right. Okay, she has said it all in terms of what the heart does, in terms of pump blood. The heart is a pump itself. So it's an organ of pump, and pumps the blood, which does all the nutrient, then also take it back to the lungs for it to be like the carbon dioxide, so that it can leave the body, take some to the kidney, so that it can be excreted. But another interesting thing about the heart is also that it has its own electricity.
Oh, wow.
Yes, the heart is very interesting. It generates its electricity that we called a station called the SA node. Okay. So that's why they can say someone is brain dead and is not totally dead. You'll be on a ventilator because the heart has not switched off its own lights, in quotes. Yes. And so when you are trying to treat the heart, you look at it in terms of what she's already said, in terms of what it pumps, how those nutrients go around, and in terms of electricity it generates. Because if anything happens in that electricity flow in the heart, there's a problem. The person can collapse. If it's too fast, the person can feel his heart is pumping too much. If it's too slow, then you're feeling dizzy and all of that. So it's actually a complex organ that is very interesting. Yeah.
Quite interestingly put. So let me stay on you a bit, Dr. Oladeji. What signs might indicate your heart isn't functioning at its best, even if physically you feel fine? Are there signs that you would feel that even as I'm sitting now, that I'm looking the way I'm looking, are there things that can be going on that I wouldn't be aware of?
Well, all right. So interestingly, there might not be any signs. Yes, and that's the sad truth, where people just collapse and like there was nothing wrong with him. He just fall and he died. But on some occasions, the heart gives signs. Like I said, the heart cries. And one of the way it cries is pain, chest pain. There's a typical kind of pain from the heart, which is like tightness, which moves either to the hand, move to the neck, which separates it from all that kind of pain that might not be from the heart, really. And it increases with either stress, climbing stairs, and all of that. Then another way you can know that there's something wrong is the heart. Like I said before, you'll be aware of your heartbeat. You either feeling that it's too fast or is irregular. So then also there are some subtle things that other people can pick. Probably leg is swelling, your breathing is too fast or difficult. Sometimes if there's water retention in the lungs, the person will be coughing. So not all cough is chest infection. It might be due to that there's a problem in the heart because of the water retention. In some cases, the water retention goes as far back as the stomach becomes big and the person cannot eat. Like when he eats little, he's already full. Wow. So it's not that the person is not interested in food. It's because the water has occupied almost half of the stomach in a way that it gets full easily. So the heart gives all these signs so that to tell you that check yourself up. But most of the times when you are already seeing all these signs, it means there's already a damage. Oh, wow. So that's why we advocate that you should do routine screening, like they call wellness check, do basic tests so that it can catch this even before those signs develop so that it can be addressed on time.
So when you said heart beats,
yes,
like when your heart beats, you're trying to say that we should take note of our regular heartbeats.
Yes.
Because I can tell you that for free, that a lot of people just go about their business. They don't even stay to, as in, I don't know if you get what I'm trying to say. It's not top of mind to be keeping track on the intensity of your heart beating or if it's beating faster or slower.
So just to go deep a little into that, usually you are not aware of your heartbeat. Your heart keeps beating and you are not aware. Yes. You go about a normal function because it's not something you are controlling. But when you suddenly feel that your heart is beating fast, it's not when you have heartbreak.
I'm hearing it now.
Yeah, it's not when you have heartbreak or there's a sad news, but you are relaxed, you are sitting, there's no problem, you are not running because when you run, your heart normally beats fast. Yes. But this, you are relaxed or you are sleeping and you are feeling that heart beating quite fast or is beating in a pattern. Occasionally, you just feel some occasional fast beats, then calms down. Yes, you should. There is that sign that the heart is crying and you need to intervene on time.
Let me stay on you a bit because you said regular checks. What are those tests? Can you list a few that people should do regularly to check their heart?
So one of those basic tests that does not cost much that we actually recommend that people do, and is actually the month for that, which month of May is dedicated to hypertension awareness.
Oh, nice.
So it's about checking the blood pressure because the heart is an organ that is damaged by all these risk factors. So there's hypertension that is not well controlled. There's blood sugar, diabetes, not well controlled. There's cholesterol that is not well controlled. So just checking the blood pressure, a cough, it doesn't cost. You can walk into a pharmacy, you can walk into an hospital, they check it. If the numbers are not good, they know you're hypertensive, and this will be treated before it gets to the point where it's that damage the heart. Sugar test is a prick test where you can know your sugar reading, you know your values, cholesterol, blood test, you know all this. So these are basic tests before it gets to the point that where it damaged the heart. So when these are done, so when now there's a damage to the heart where palpitation now starts coming, which is the awareness of the heart beating fast. That's what we call palpitation in our medical terms. That's when you do electrocardiogram, which you call ECG.
ECG,
yes, you do an echo, which is a scan of the heart. So to go deep down to know what is the extent of the damage. Sometimes some blood tests can be checked whether there's an heart attack or not, and a chest x-ray, whether it's the heart or the lungs. So those kind of tests. But the basic things come first, which is screening blood pressure, check your weight, check your blood sugar, check your cholesterol level. And when these are done, because many people are not aware. So, and what we say about hypertension is that it's a silent killer.
Very silent.
Yes. So you don't have, like I said, there might not be any symptom. And the first time the person is having symptoms is that person collapsing. Yes. So you should do those basic tests. Once your age has passed 35, yes, the risk become high.
Wow. Thank you so much for doing justice to that question. So let me come to Dr. Nebe. Dr. Nebe, can you speak to the key numbers everyone should know? You know, he mentioned blood pressure, cholesterol, heart rate, glucose as well. Can you mention, like, what ranges should they fall between, you know, to know that you're good?
In addition to the three, we have the basic other ones that we could do. We could check the pulse rate. You know, some people, just like you talked about palpitation, that's irregular heartbeat. That's your heart beating and you're perceiving that your heart is beating. I want to point out that it's not in all cases we have palpitation, that's being aware of your heart beating, that it has to do with the heart, really. So there are other conditions that could cause that. For instance, we on this side, the family physicians, we look at it as something that you do holistically. Because at times, anxiety, even if you read about it, anxiety is the commonest cause of palpitation. I'm sure before we started this program, you were palpitating a little. That's why.
Shots fired.
Yes. So that's anxiety. So now when it's consigning the heart, what happens is that when the anxiety goes away, the palpitation continues.
So it takes a while.
So it continues. So even when there is no anxiety, nothing causing it. For instance, if a lion comes in here, all of us will palpitate. We palpitate. We all palpitate because of a particular hormone that causes it, adrenaline. But for the heart to have a problem, the palpitation continues. Okay? So one of the numbers that will tell you that really something is wrong is your pulse. So your BP could be normal, nothing happening, but you find out that your pulse is persistently above 100. Once you count it, it's above 100. Especially when that palpitation is going on. Okay, that's fourth one. We've talked about the diabetes, we've talked about the cholesterol, then we talked about the blood pressure.
Blood pressure.
So for the pulse, let's start by the numbers. For the pulse, we expect the pulse to be between 60 and 100.
Okay.
So when it's below 60, you are thinking that the pulse is low. The person could come in with maybe dizziness, weakness, especially on little exertion, because the heart is not pumping as much as possible.
Okay.
Then if it is above 100, that is tachycardia. That means the heart is pumping more and it will now result to palpitation.
Yeah.
So the person starts feeling the heart pumping. So that's the numbers for that. Then if you are talking about for sugar now, that's the glucose, you have based on fasting. We normally advise you do fasting.
Yes.
That's 8 to 14 hours fast. So we expect it to be almost the same range, 60 to 100.
Okay.
So if it is less than 60, we are looking at low sugar. Above 100, we are looking at high sugar. However, we have a cutoff for it being diabetic. So above 100, we say, okay, it's high, but we could do something. But when it's above 126, we start thinking of diabetes. Then going to cholesterol, we actually use basically 2 parameters. So you don't go do total cholesterol and assume that's all.
Okay.
Because your cholesterol can actually be normal, but the breakdown will be a problem. So we need that panel. Okay. What we call lipid profile.
Yes.
So it tells us everything.
Yes.
So we actually need 2 particular one in that lipid profile. The LDL and the HDL.
Of course.
So that's the most
good
important.
And the bad cholesterol.
Yeah. So it could be normal 200 or less, but you're deviating towards the bad one. So the breakdown will give us a very high LDL, in as much as the total is good. So it's that LDL that informs cardiac health. So now, for everybody, we expect the LDL to be lower than 100. In most cases, irrespective. Then we expect for the male, the HDL to be 40, then the female 50. That should be okay. Then the last number, I think, we've talked about blood pressure, yes. So we expect the blood pressure to be between 100 and 139. For the upper one, it's 2 ranges.
Yes.
Then for the lower one, we expect it to be 60 to 89. Nothing lower, nothing bigger. So when you're saying, my BP is on borderline, I always get 140/90. I'm always there in 149. I used to use one adage for my patients. I tell them that if I need to pull down this house, I could use a bulldozer. I can as well use a hammer. The only thing, it will take me time to push it down.
Wow.
So if it's persistently 140, 142, 140, you claim it's borderline, but it's still pushing down something. So we aim that the blood pressure should be the other side of 140 at all times, the other side of 90 at all times. Then another thing we didn't mention is the weight. Yeah, the weight's very important. So we have something we call basic body mass index. It's a
BMI.
Basic measure, BMI, a basic way of maintaining our cardiac health. We expect everybody to fall into a group, So we say that the normal BMI, which is calculated using your weight and your height. So you might be slender, very tall, but you're very heavy.
It would interest you to know that I am overweight based on my BMI.
Yeah, it takes a lot to maintain that weight.
Yeah.
Majority of us are overweight in Nigeria. So you can be very slender, very tall, but you're very heavy. So you have to use 2 parameters to measure and know your BMI. So the normal BMI stands from 18.5 to 24.9.
Oh, nice.
So once it's above that, you're overweight. But by the time we are getting, 24.9, yes?
Yeah.
By when we are getting to 29.9, you're now going to obesity. So, obesity, yeah. So we have to work towards not being overweight. We have to try to fall in between 18.5 to 24.9 when we calculate it. So it's calculated based on the weight, your weight over your height squared. Simple mathematics. Your weight in kilogram, then your height in meters, multiplied by itself. That's what squared. It means squared. Okay. So once you calculate it, you will know where you're falling. Then you start working towards getting to the better part. So that's the 5 basic numbers we work with.
Let me just ask. So what would you say about those that are underweight?
Okay, so for underweight,
what do they do? How does it affect them, and what can they do to?
Yeah, being underweight also affects cardiovascular health.
Wow.
Yes.
And we thought they were lounging.
No. I think based on studies, when you're overweight, the body mass is reduced. Mm-hmm. So majority of them will come with also things that will affect the cardiovascular health. Number one is that you find out that in what you call lipids tends to sediment more in people that has low metabolism.
Okay.
People that are not active. So irrespective of whether you're thin, whether you're slim, whether you're underweight, it does not matter. And study has also shown that people that we are having malnourishment had higher chances of cardiovascular issues. For instance, people that had kwashiorkor during World War, majority of them came down with diabetes.
Oh, wow.
And with, you understand? So, and even people that had marasmus. So underweight is also a problem. So we should work at maintaining our body mass index at a healthy level.
Wow. Thank you very much, Dr. Nebe, and thank you so much, Dr. Oladeji. This has been an exciting episode. Very interesting and eye-opening discussion. You had me at the underweight too. And please, if you are, I know a lot of us are actually aware and they go and check only cholesterol. Please extend it to lipid profile. Don't go and do only cholesterol and think you're fine. Dr. Nebe has said we are looking for HDL and LDL too. Please add to your to-do list.
Okay, you also had one more thing.
Yes.
In the panel, like you said, there's also total cholesterol too.
Mm-hmm. Yes.
And there's also triglyceride.
Yes.
TG, yes. So, though LDL is what is used in predicting cardiovascular disease in terms of death, stroke, heart failure, and all of that, but if the triglyceride, that TG, is also very high too. It could be a pointer too.
Oh, wow.
Yes, and the total cholesterol too. So they are not so innocent. Yeah, they are not so innocent too. So,
wow.
Yeah.
There you have it. They are not so innocent. So you do your total cholesterol, your triglyceride, your HDL, and your LDL. There is even a ratio to that.
There's a ratio. And even new studies are coming with lipoprotein.
Oh, wow.
Yeah, and the apoprotein. There are new studies coming to predict cardiovascular diseases. Yeah.
Oh, wow.
So things are evolving.
Yes.
Yes.
Wow, that's quite impressive. Thank you very much, Dr. Nebe and Dr. Oladeji. This is a very interesting and an eye-opening discussion. You know, the part that you have to do the full lipid profile, not just the cholesterol, not just the total cholesterol. You can do your cholesterol with your triglycerides, your HDL, and your LDL. And these tests are done at Synlab, Nigeria. If you have not done it, you should start doing it now. Do not forget to like, subscribe, share, and follow Synlab Nigeria on YouTube and on Spotify. Stay tuned, and we'll be right back with more to come.